Church Health Center began in 1987. Our mission is the same today as it has always been, to engage the community of faith, to say, what is it that God expects of us to care for our bodies as well as our spirits? You know, when you read the Bible, a third of the Bible has to do with healing the sick. It's on every page. And yet, in today's world, we have forgotten that. You know, we have forgotten that God expects us to care for this body, the greatest gift we've ever been given. Every church should be involved in trying to keep our bodies healthy because we are an incarnational church. We believe that God loves us so much that God becomes just like us and that we are to honor that great gift that God has given us. So how do we do that? So in my mind, every church ought to be involved in health ministry. You want good preaching. You want a good Sunday school. You want a good choir. Well, you also ought to want a good health ministry.
Our healthcare system has let us down. Less and less of those kinds of caring and healing things are available to people. There are a lot of pieces that have fallen through the cracks, and nurses who are working in their congregations really have an opportunity that they can bring that to them, and with the listening and their presence, offer something to people that they need.
Now that the Church Health Center is the home of the IPNRC, we really want to focus on the team-based approach and make sure that faith community nurses have the support that they need in order to do their ministry.
Every health disparity that is within our congregation, within our community, Church Health Center is addressing it. They have either a program here that's already established, or they're going to connect you with someone that will be able to help your congregation.
We now have over 1,000 congregational health promoters, and they've been trained not only to identify symptoms of common diseases, but they're trained to learn to coordinate health ministry in their places of worship.
About twice a month, we have immediately after the 11 o'clock service, we have blood screenings, trying to detect those who have uncontrolled blood pressure. And they come, we put it in the bulletin and the pastor announces it from the pulpit, and they will come immediately after church and get the blood pressure checked. And our nurses do that.
I tell our congregation, I said we must be careful. We cannot dig a grave with our teeth. And it's a constant awareness that we have trying to share with people to be careful what you put in you. And I kind of live by that myself. We have to watch how we are digging a grave bite by bite. We don't try to be what the hospital can be or what the church health center can be. We don't try to be that. We just try to facilitate some type of health until they can get to the real professionals to fix the situations.
Not only do they have passion about being healthier, but they have compassion for the individuals in their congregation, and that's an important characteristics for congregational health promoters. They don't have to be health professionals, they can be lay individuals, but we do want them to be respected in the community so that individuals would trust them.
The variety of activities that parish nurses do is endless because they really fit it to the needs of that congregation. And most nurses who come to our courses and learn about faith community nursing love it because it's like, well, this is what I really went into nursing for. This is what I've always wanted to do.
It doesn't matter the age, there's something for everyone to do. It doesn't matter the sex, male, female, young, old, anyone can do health ministry in their congregation.
Health ministry is the church. If it's not physical, mental, spiritual, emotional, it's not even a church, it's not even a body. So it's no way that you're not affected some kind of way by health ministry.
So it takes a real team. It can't just be the responsibility of one person to carry health ministry in the congregation. Now that the Church Health Center has this targeted outreach to faith community nurses, there are a number of things that we want to do. First and foremost, we want to continue to provide the same cutting-edge education that the IPNRC created.
Keeping people healthy cannot be dependent on people who wear white coats. You know, coming to the doctor, that's not going to make you healthier. It's figuring out how to live the healthy life. The very thing that the church is all about. Having a faithful life includes having a healthy life.
It's a new era here at the Church Health Center. Because of our success, we now have people who are coming not just from all around the country, but all around the world, who are coming to Memphis to learn about our model.
There's probably about 25 or 26 countries who are now connecting with us who have parish nursing in their countries. You know, from Australia, Canada, and England, and Australia were the first countries where it spread. But I mean, now we have nurses in the Ukraine, we have them in a number of countries in Africa, Ghana, Nigeria, Zambia, Zimbabwe, South Africa, Swaziland, Madagascar, where my husband and I have gone.
Faith community outreach at the Church Health Center is about taking the work that we are doing on the ground here in Memphis and making it available to anyone who wants to use it.
We want to help a church create a health ministry based on its needs. We want a church to be able to come to us, work with us, and use our strengths and our talents to help that congregation figure out what's best for their people.